Hi, I'm Dr. Karen Reluccio. I am the Public Health Officer and Deputy Director in Health and Human Services Agency. Basically, our my division strives to prevent communicable diseases, chronic diseases, and to address health equity issues. We also strive to prevent secondary complications of disease. At this point, most of the response really has been focused on COVID-19 prevention. So it's either prevention of transmission or else prevention of COVID-19 in the first place through vaccination and other measures such as wearing masks, social distancing, and frequent hand washing in order to prevent COVID-19.
Yeah, I'm Crystal Milne. I'm a full-time epidemiologist working on COVID and part of the Public Health Department in Napa County. And I'm proud to be part of a team that, whether or not COVID is happening, is really working hard to promote health equity and to have our decisions be made by data. So my part of this puzzle, what I'm hoping to do is provide the data that other people use to make decisions that will hopefully guide the community to prevent, spread, to prevent some of the peaks that we've seen, and to hopefully get the vaccines where they need to go and that sort of thing.
So my name is Canciola. I work for Napa County Public Health, and I'm an analyst. This last year, I've been really focused on COVID-19 response. I think what I've been focused on trying to prevent, I've been working with a team of social workers who provide support to families in isolation and quarantine. And we're really, once these families are impacted by COVID, what we're trying to prevent is worse health outcomes. So making sure they have appropriate food while they have to isolate or quarantine, making sure their immediate financial needs are met if they don't qualify for certain benefits and have loss of income due to the disease or the virus, and just making sure that they, that they're safe and immediate needs are met. So we're trying to prevent worse health outcomes for these individuals that have already been impacted for COVID.
Hey, my name is Anna Fernandez, and I work for public health as a health and human services technician. My normal role is providing administrative support to Dr. Reluccio, but during COVID, I've been focusing on case investigation and contact tracing.
Hi, my name is Maura Snyder, and I'm a Napa County public health nurse. I currently work as a school liaison. So my primary job is to help prevent transmission of COVID in the schools, and to look at each positive student or staff to keep the transmission low. I am striving to prevent school-related secondary exposures so that we can keep children attending school.
Napa County Public Health has 17 different programs that serve, chronic disease and health equity, communicable diseases, immunizations. We also do, we are administering emergency medical services and emergency preparedness, as well as, other programs such as registering birth and death certificates. Our epidemiology unit does a lot of investigation and gives us data in order for us to make decisions. And then we also have child and family services through home visiting and through California Children's Services that serve children with disabilities. So we have a lot of services that are going on. I think that the services that were probably most needed outside of our COVID-19 response is, first of all, our women, infants, and children, or WIC services, was highly needed because there were a lot of people suffering from food insecurity during this pandemic. In addition, we also have a Free Friday market, which was fully utilized during the pandemic. And then additionally, I think a lot of there's been pretty much all hands on deck for the COVID-19 response. So the 17 programs that we've had, they're not all functioning at its full capacity, and we've had to prioritize which ones have to continue to function fully, and then others where we can divert staff to respond to COVID-19. And then in the beginning of 2021, we've also been in a situation where we can provide vaccinations. So our immunization services have been really busy in 2021.
Really, the most essential was just the support from public health, from our management, Dr. Relucio just being an amazing, well, she's an amazing health officer, but having her at the top and then, trickling down to our team, just the support. But really in regards to the schools, I would say that it's the collaborative efforts, the communication, a quick response. I know that, other counties, larger counties may not have the process that we have because their response is much larger. So I feel very fortunate that we're, for example, if a child is exposed within that day, we've already, identified contacts and sent quarantine letters out to the families, worked with the schools to make sure there was no other exposures. It's very quick. It's a very quick response. And I think that's what I hold really close to my heart is like how hard everybody works. And the goal is that, of course, we don't want any secondary exposures.
Coworkers that are super supportive and willing to listen and help figure out how to get something done when it feels overwhelming. I really feel proud to be working in public health and because it's the people, it's just, I work with a lot of really great people who have a lot of passion for supporting the community and for public health and what we do. So that has made it, more doable.
I think just treasuring the moments where, people are really, just wonderful to us. For example, we had someone make us a whole bunch of masks and they brought, Girl Scout cookies for the vaccinators and, bouquets of flowers. I think that there's just a lot that has happened that was where you have to really soak that in order to keep going.
And this time has been so disruptive to how we work and where we work. So even though Zoom fatigue is real, I'm very grateful to technology like this. It helps at work, obviously, but it also like FaceTime, I get to keep in touch with my best friend and her little guy who just turned 2 and I hadn't seen since he was like 6 months old. So like we would have lost that connection. My family lives in Canada and the border's been closed for a long time. So it's been the way that we kept in touch. It's been the way that we got to have a funeral for my grandpa. So I'm really grateful that, I'm sad that the COVID had to happen. I'm glad it happened at a time where we could stay connected.
So something really important for me during this response has been managing my own stress. And just as Dr. Relucio mentioned, the support of my spouse, the support of my family has been so important. So just being mindful of taking care of myself so I can help take care of others.